Taylor, and my project is over aphasia. So many people know someone who's had a stroke or brain injury, but they don't know the complications that could come after, which would be aphasia. As aphasia is brain damage impairing an individual's ability of processing language. So that's impairment in understanding and production of language. As mentioned earlier, it could be due to a stroke, but it also could be due to head injuries, cerebral tumors, or degenerative dementias that disturb the cerebral areas that deal with language. But mainly it is a stroke, and it's the acute ischemic strokes as they block blood flow to the brain in the left hemisphere. Strokes account for about 100,000 cases of aphasia each year in the United States alone. Much of the brain damage is characterized by lesions in the frontal and temporal lobes that deal with language. The most basic form of aphasia was thought of in the 19th century, believing there are a few different types, but they mostly believed that there were the main pathways of just networks of neurons in the brain, thinking that those were the ones that dealt with, there's only a few that dealt with linguistic skills, but now they know that there are tons of neural networks that deal with language skills and the use of memory and language in both the hemispheres, but mostly the left hemisphere. As damage to one of these creates the symptoms of aphasia that we see. And aphasia is a serious condition that can affect not only individuals but also their families, as it is hard just to communicate with another person, along with it being stressful to their physical and mental health. When learning about aphasia, it is important to understand what it is not. It is not a disorder in perception, motor movement, or thought processes, as it's simply an individual cannot make the connection between their thoughts and their language. It is a disturbance in the processing of the different aspects of language, and they're presented in different forms. So we're going to talk about that, as there are 5 components of language. There are phonology, morphology, syntax, semantics, and pragmatics. So just like a disruption in any of these is a disruption in language, so that can be seen in different forms. So if you cannot produce a word or make a coherent and organized sentence, that's a problem in phonology, morphology, or in syntax. But if you can't follow directions, know meanings of words, conversate appropriately, those are problems with semantics and pragmatics. All of these have trouble understanding some form of component of language. There are different types of aphasia that obviously elicit different responses from individuals, but it's all processed in the left hemisphere, so depending on what type of aphasia you have is dependent on where those lesions and damage is in your left hemisphere. Some struggle with communication between thoughts and language and being able to convert sequences or organize grammar or put thoughts into symbols, while others struggle with visual and auditory cues. But many have described it as being trapped in your own brain, which is really scary. But we're going to talk about the different types of aphasia based on the components of language that we know. So the first is Broca's aphasia, which is damage in the Broca's area of the left hemisphere, and it deals with the motor production of speech. So damage can be non-fluent aphasia or Broca's aphasia, and individuals can understand language and what they're hearing, but they cannot make a connection of the motor part of either speaking it or writing it. So it's just kind of a bunch of mumbo jumbo when they talk, and it is seen that people with Broca's aphasia are more stressed in situations than people with Wernicke's, and we're going to talk about that in a second. And they just have trouble finding the correct words, using linking words, and they just have real sloppy and slow speech. While Wernicke's aphasia is damage to the Wernicke's area in the left temporal lobe, and it deals with the comprehension of language, and damage to this can also be called fluent aphasia, where they can talk fluently and have intelligible words. Their words and sentences just make no sense in order. They lack the ability to find words and meanings in their lexicon, and written language is also processed through the occipital lobe, which then goes to the Wernicke's, so they also have trouble with written language. Spoken language, motor skills, and language production, like I said, all are intact. It's just their ability to understand is compromised. And it's just, they're intelligible words, but they don't make any sense in order, and they have no meaning to them, to anybody else listening to them. So conduction aphasia is when comprehension is intact, but production has trouble through repetition. So the words are intelligible, they just repeat a lot. And individuals find it difficult to repeat a sentence exactly as they heard it, or trouble finding a word. There's damage to the supramarginal and the auditory cortex, along with the part of the brain that connects the Broca's and Wernicke's area, as they have trouble hearing and repeating a sentence. And they just repeat the production, the phonemes and the morphemes. So it's obviously part of Broca's. Global aphasia is a complete total loss of production and comprehension of language, and they can only formulate short phrases, but they are intelligible. Their lexicon is very limited and very automatic, and it can be damaged to both areas. Next, we'll talk about speech therapy, and I'm studying that, so I find this really interesting. Many who develop aphasia go to see a speech therapist, try to recover some of those skills. The first step is determine the function of their language skills, to see what they can do, what they cannot do, and many wonder if they can even recover from brain injuries as adults, because most people know that children can recover from different injuries, as their brain is very malleable and they have that plasticity, but adults also can. It is a little harder, but they still can, and your brain is so crazy, it works in crazy ways that it's able to just reconnect and make new connections to help you learn new skills. So it is a little bit harder, and they do need the assistance of an SLP or somebody else, and do gain new skills and new strategies. But it can take a toll on a patient. It can also take a toll on their family, as communication becomes frustrating, there's conflict, there's avoidance, there are burdens in those families. So treatment often depends on the age of the client, the severity of their case, their symptoms, their intelligence before the incident, their emotional state, and any cognitive defects they had before. Also, the amount of social support they have. It affects, like I said, their families, so a lot of speech pathologists include the family or the caregiver in therapy, so they can learn the strategies and help with feedback outside of therapy. The SLP also uses many cues and techniques, and uses pictures and gives appropriate response time, allows for keywords to help them. And there are many different types of therapy. Like I said, there's group therapy, but there's also individual therapy, and individual therapy is one-on-one that work on skills to help with daily tasks and goals. And group obviously usually includes the patient and their family to help, like I said, just with education, but also that social feedback and those social interactions. And it also helps give them a sense of normalcy, helps with their attitude towards their disability, and just improving their physical and mental health. Improving their quality of life for those with aphasia and their family members is important, and that's why they created intensive, comprehensive aphasia programs. And these programs result in improved severity scores on communication and written language, but not as much on expressive and receptive language, which is a lot of what you do in everyday life. Different approaches and severity depends on what kind of techniques they got. So there are 2 techniques I researched, or approaches, and one is called VNES, which is Verb Network Strengthening Treatment, and MIT, which is Melodic Intonation Therapy. So VNES improves expressive language and helps with word finding and creating sentences by finding the correct words and producing the words. They use like a list of words, very broad words, and verbs and WH questions that help them give a routine of answering in subject-verb order. It tells you just who's doing what in a sentence, and it just gives them structure and uses very broad terms to help them figure it out, and helps with expressive language and writing skills. They can also pick MIT, which is a Melodic Intonation Therapy, and helps with expressive language, as often people find it easier to sing than to speak with aphasia. So they use singing to help with repetition and increase phrase length. They also can sing the phrases and get that pattern, and they can also tap it out. So with these, my experiment that I would talk about or would give would focus on therapy techniques and how they help improve language skills. So I would look at their severity and the motivation for recovery, and make sure those are to what they need to be, and I would just see what therapy and techniques and approaches work best to help improve expressive and receptive language. So I would do VNS and MIT, based on what I said. So I would do 12 groups. I would do 3 individual groups that work on VNS, so 3 groups with one-on-one, 3 groups one-on-one that would work with MIT, and then 3 groups of 3 people in a group that would work on VNS, and 3 groups of 3 that would work on MIT, so just to see if individual versus group, and also those 2 approaches, and they would do it over a 6-week period. And then I would come back and use the same diagnostic test to see their scores of expressive and receptive language.